आपको लैपटॉप में देखना है, फिर जब आप बोल रहे हैं कैमरा में देखना है। क्वेश्चन के लिए लैपटॉप, आंसर के लिए कैमरा। क्वेश्चन के लिए कहाँ दबाना है?
नहीं, क्वेश्चन यहाँ पे पॉपअप होंगे सारे,
अपने आप आ जाएंगे।
ब्राइटनेस एक बार बाहर जाके देखना,
ब्राइटनेस काफी ज्यादा है, सही कह रहे हैं।
हाँ,
मैं बाहर जाऊँ फिर?
हाँ, जाके ऊपर चेक कर लूँगा।
I'm waiting for the notification. It's live already.
हो गया?
क्रॉस करना है। Hello everyone, I'm Dr. Aruna Kalra, Director Ops and Gynae Department at Birla Hospital, Gurgaon. Today we are going to discuss endometriosis. Endometriosis is a very frustrating disease. I know many of you must not be aware of endometriosis, but you definitely would be aware of symptoms of endometriosis. So let me put you at ease and share a story with you. So there's a girl who comes to my clinic. She is 18 years old and she is having severe pelvic pain during her periods. Pain starts before her periods, it aggravates during her periods and stays even after that. It starts after 2 or 3 years of her initial periods, first periods, which is called menarche. But it goes and on and on. And it is increasing now with every passing month. Sometimes she feels that pain is constant all throughout the day, even if when she's not menstruating. And sometimes she feels that she is having pain during urination and feels all the time like pooping or pressure down near her anus. Her mother brought her to me and she was averse to any painkillers. She was teaching her that this pain is absolutely normal. Everybody, like her mother-in-law, or everybody has this kind of pain, had this kind of pain, and it is absolutely normal to bear this kind of pain. And she should not be taking any anti-inflammatory or analgesic drugs to suppress this pain. This girl who's just 18, she is athletic, she is preparing for entrance exam, but she is not able to do her day-to-day activities and definitely not able to attend school during those 4 or 5 days when pain is really severe and she's tossing on the bed. When I asked her whether she ever went to a doctor or shall we start diagnosing her by what is causing her pain, her mother was absolutely sure that it is normal menstrual pain. We started investigating her. We did ultrasound, which showed that her ovaries have 2 chocolate cysts in both the ovaries. Chocolate cyst is brown tar-colored blood which was filling the ovaries and destroying the ovarian structure. And from there, we started her treatment. So chocolate cyst of ovaries in endometriosis is very common finding, but not every girl would be having this kind of finding. Let me tell you, endometriosis is actually prevalent in 1 in 10 girls, which is really high percentage. It is 10% of all female population. And it is mostly giving us chronic pelvic pain, which we also say CPP. It can present with infertility and many other symptoms like heavy irregular bleeding. Most of the time, we are not able to diagnose with any diagnostic modalities. Like ultrasound might be helpful, but every time ultrasound would show some kind of cyst, ovarian cyst. No, it's not like that. Most of the diseases of like endometriosis in stage 1, stage 2, which is say mild, moderate, they are very, very superficial on peritoneum and are not seen in ultrasound or even in MRI. So let's start. What exactly is endometriosis? Because case and this girl now is diagnosed that she is having ovarian cyst. So what exactly is endometriosis? Endometrium is the lining of uterine cavity, which every month bleeds or sheds. This endometrium lining, when it is there on the ovaries and tubes and peritoneal structures. So if we are menstruating down through vagina, and if we start menstruating retrograde through our fallopian tube into our peritoneal cavity, this endometrium sheds on the ovaries, fallopian tube and peritoneal cavity, and it starts growing there. But endometrium, when it grows, it cannot come out from the endometrial cavity. There is no space, there is no exit, and it starts growing there and starts producing inflammatory reaction, and it is really, really painful because there is no exit to it. So this inflammatory reaction on the peritoneal membranes, on the ovaries, fallopian tube, and everywhere, like on your bladder or rectum, starts producing menstrual blood or bleeding there, where there is no space or there is no exit. And this happens every month. So every month, this girl is menstruating backwards, and this blood is spilling backwards on the ovaries, fallopian tube, and other structures of your abdominal cavity. And because there is no exit, there is pain. So endometriosis definitely is a progressive disease, because if everybody is menstruating every month, this is going to shed every month. And this endometrial, these endometrial glands or blood would go on growing there, increasing there, and spreading on peritoneal membranes or all these structures. And that is why initially it is a little painful, lower abdominal pain, but progressively pain starts increasing. These endometrial glands start producing more and more inflammatory hormones, and growing there. They distort anatomy of fallopian tube, ovaries. They are sitting on urinary bladder, they are sitting on bowel, and every act is painful now. Act of urination is painful, act of passing stool is painful, and constantly you are in pain. But if you are sexually active, you would feel pain during intercourse also. So if we understood what is the pathophysiology, like endometriosis is retrograde menstruation, where menstrual blood is going backwards and falling on your ovaries, fallopian tubes, and other organs, abdominal organs, and growing there, we understood that, okay, this is going to be a progressive disease. And treatment would be to stop this retrograde menstruation. And how to stop this retrograde menstruation? To stop menstruation altogether, which is kind of a menopause, which nobody would like. Definitely, your mother would not like, if you are 18 years of age, to stop your menses, because it might affect your fertility. But here, what we need to understand is endometriosis, if it is a progressive disease, it would affect your fertility much, much more than stopping your menses. So we need to stop this for this retrograde or for this blood to collect on fallopian tube and ovaries, and then treat whatever is already collected, whatever is already there, those implants in the peritoneal cavity, on your bladder, on your rectum, on your ovaries in the form of chocolate cyst, we have to remove everything surgically. If somebody is coming with chronic pelvic pain or painful intercourse or irregular cycle, painful periods, or all these pains, how to diagnose it? Because as I said, that mild to moderate would not even show on ultrasound, because these are very, very microscopic structures which are underneath the thin membrane of organs, like below the bladder membrane, below the bowel membrane. They, it would not be shown on ultrasound, and sometimes not even on MRI. We have some blood tests like CA125 and all, but every test might not come positive. And sometimes we just have to clinically diagnose, because this is a progressive pain and because it is increasing, and it was initially only during periods and now it is throughout the month. We have to clinically diagnose that you might be having endometriosis. And if we feel that you might be having endometriosis and ultrasound is not showing any sign of it, definitive test to diagnose endometriosis is laparoscopy, which is minimally invasive surgery in which we go inside your peritoneal cavity, look at your fallopian tube, look at your ovaries, and see if those red or brown or whitish scar tissue, all those implants are scattered on the peritoneal membranes, on your urinary bladder, on your bowel, or all other structures. And sometimes anatomy will be distorted. So laparoscopy is the gold standard test to diagnose endometriosis. And we have to take the biopsy of those implants and test under the microscope whether those tissues are endometrial implants or not. Or sometimes old blood would be there under the microscope. But do you think that everybody would be ready for a laparoscopy to diagnose it? Sometimes we give estrogen progesterone tablets or only progesterone tablets to suppress that pain, and pain is suppressed. That's how we are able to diagnose that, okay, because pain is suppressed with continuous progesterone tablet or estrogen progesterone tablet, this might be endometriosis, and we might not, we should not go for laparoscopy. But yes, if you'll ask me, 100% diagnosis, if ultrasound or MRI is showing some kind of ovarian cyst, we can diagnose that it is endometriosis if it is chocolate cyst. But if ultrasound or MRI are not able to see any of those implants or those cysts, we have to believe our clinical acumen and sometimes giving continuous estrogen progesterone or only progesterone therapy. And if it treats your pain, we are able to diagnose that it might be endometriosis, and more often than not, it is endometriosis. So there are a few questions. I think in between the text, I can take that question. Simran is asking, hello ma'am, I'm suffering from frequent menstrual cycle. It has happened to me 4 times, that is, for 16 days in a month, which is causing me major weakness and body ache. Simran, definitely it is not good to have after every 15 days or 16 days. We have to understand that it should not be caused by us. Okay, by that I mean that sometimes if you are taking hormonal tablets like morning after pills after every sexual activity, chances that you might be having a irregular period are very high. I'm not suggesting, I'm just telling that people take morning after pills and they are not aware that it can cause irregular bleeding. But if bleeding is after every 15 to 16 days, we need to do ultrasound and see whether you have some kind of growth, which is polyp or fibroid, or as I said, endometriosis. Sometimes we are able to see some or the other pathology, sometimes we are not. And then we say that we have to do some hormonal tests to check whether your thyroid is not right, or other hormones, or like say you have been insulin resistance. Without having an evidence of abnormal finding either in ultrasound or in blood tests, we should not say that you are having this kind of disease. Sometimes some people are lactating or breastfeeding, and they might be having irregular cycles. So yes, if you are having this kind of cyclicity, which is after every 16 days, it can deplete your hemoglobin, it can make you anemic, and it is not healthy. You should go to your gynecologist and get it diagnosed, and it is preventable and treatable. Don't worry, Simran. I have severe pain during periods. Does this mean I have endometriosis too? So, Vichitra, severe pain and pain threshold for everybody would be different. So, somebody would be having a really high pain threshold, and somebody would be having really low pain threshold. So, we have, if somebody is having severe pain and she's not able to do her day-to-day activities during those 2 or 3 days of her periods, and if it is associated with, say, bloating of abdomen, nausea, low backache, lower abdominal pain, which is going towards or radiating to the thighs, and uh, not able to do other normal activities, or going to poop very frequently, all these things, and periods pain starting, say, 2 or 3 or 4 days prior to actual period date, and lasting much, much more than even after that, would be abnormal. But again, as I suggested, that even first 2 days, if you are having pain, do not take lightly. At least start taking anti-inflammatory drugs, tablets, to stop your pain, because nobody needs to have pain or bear that pain and stop their life, day-to-day activities, just because they are having menstrual cramps or pains. And it is absolutely safe to take anti-inflammatory even 3 times a day. uh, this is okay. Thank you, Ashish. Pritika is telling, can lifestyle changes prevent this? Also, is this hereditary? So, Pritika, lifestyle disease. This is, I would not say definitely a lifestyle disease, but yes, lifestyle. If you say, we, if we understand that this is hyperestrogenic disease, so our estrogen is more, progesterone is less, and there is some imbalance which is causing. If our estrogen is high, we have to see why estrogen is high. So as I said, that okay, it can be hereditary. Your mother had and your grandmother had, and this kind of gene you have also acquired. But most of the time, it is not hereditary. And if you are having lots of packeted foods, lots of food which are not organic, uh, food which has which are treated, say, with pesticides and all those inorganic things. If we are taking all in, or not very organic food material, soy, or for that matter, many things nowadays are not pure. And I would not say that you can stop eating everything, but I would say that try to eat healthy and exercise regularly, because more and more packeted, frozen, and food with preservative, if we are using, they are all high, rich in mm, estrogen content. And estrogen, if increases in our body, there is imbalance between estrogen and progesterone, and these implants are estrogen dependent. So if we are obese, if the obesity also has lots of estrogen receptor on our fat cells, and with obesity our estrogen content increases. So if we are having all these kind of if BMI is high and PCOD is there, these can also cause high estrogen content in our body, and lifestyle has a role to play in endometriosis. Okay, Samarth Kapoor is asking, my wife has undergone surgery for endometriosis. Can we still have a baby? So, Samarth, yes, first thing I would like to tell you that absolutely, absolutely, you can have your baby, your own baby, naturally, or we have many other means to give you a healthy baby. But if she had a surgery for endometriosis, I would want to believe that after surgery she is cured properly. Her disease has been eradicated from her abdominal cavity. And once it is removed, disease is removed, our ovaries are functioning again. And if ovaries are functioning, and if she has good amount of eggs in her ovary, and we do not have much time with us, we can always go for IUI or IVF, ovulation induction IUI or IVF, and you have fairly good chances of having your own baby. So relax. Okay, so hello, ma'am. I'm 40, and now the initial 2 days of my period are extremely painful. When I pass urine or poop, and when I pass on gas, I feel severe pain in my pelvis. Does that mean I have endometriosis? So, Mrs. Saxena, uh, it is like symptoms, what you have suggested here, that uh, you are having 2 days, but it is severe, and during pooping or passing urine, you are having pain. Chances that some endometriotic implants might be there are high, as clinical history is suggesting that. But before coming to conclusion or diagnosing you, we should have an evidence. Better to get first one ultrasound. If ultrasound, as I said, that ultrasound would not be able to diagnose or tell you that you are having endometriosis every time. So first thing is endometriosis. Sometimes when we do transvaginal scan and we put probe in your vagina, and are having pain while we are testing your posterior fornix or uterus, touching your uterus and cervix, that also suggests that some implants are getting pressed and you are having pain, and this is endometriotic implant which might be giving you pain. Or if intercourse is also painful, even otherwise, not during periods, even otherwise, that also suggests that some implants are there on your bowel or on posterior wall of your uterus, which is giving you pain. So yes, it can be endometriosis, but without an evidence, it's not right to say. Treatment is available. You can start anti-inflammatory right away, thrice a day, and further you can go on. If you have completed your family, estrogen, progesterone, or only progesterone tablet would give you beautiful relief. Nandini is asking, after hysterectomy due to endometriosis, what can I expect? Will it cause menopausal symptoms? So, Nandini, first thing is hysterectomy is not the eradication of disease. First thing, we'll see, what we should understand is that endometrial or menstrual blood, which was coming from the vagina, now has gone through fallopian tube on your ovaries and on your peritoneal cavity and all other organs. Now it is sitting there on your urinary bladder, on your bowel, on other structures. If I remove uterus, it does not eradicate or clear those implants. So removing uterus would not treat your endometriosis, because ovaries are still there. Ovaries are producing hormones, and if ovaries are producing hormones, these endometrial implants, which are everywhere else, which are lying on every other organ, would still be bleeding every month. So even if I remove uterus, those implants would bleed and give pain to you. So in if you have crossed that, like if you have had your family completed um, at the ages towards 40 and beyond, and there is excruciating pain, and we have tried, and every kind of treatment, operation or surgery is the only treatment left, which is, as your doctor suggested, hysterectomy. Only hysterectomy would not help. Hysterectomy with oophorectomy or removal of both the ovaries. And then, because we are removing ovaries, we should put you on calcium and add back therapy, which is estrogen, for postmenopausal symptoms. But this is one surgery which we were discussing because you asked about hysterectomy. Otherwise, for pain, endometrial pain, or removal of endometriotic disease from your peritoneal cavity or abdominal cavity, hysterectomy is not required. We can do deep excision of all the endometrial implants wherever they are, and then put you on progesterone only tablet, or which is called Mirena, or intrauterine LNG device, that is a constant progesterone, post surgery, post removal of endometrial implants from the cavity, from everywhere, from every organ, and put you on progesterone tablet. That would give you much relief. Hysterectomy has other indications, but only hysterectomy would not cure or relieve your pain. So Manish Kumar said, what precautions to take before planning second pregnancy post IUFD? Any must take medical test? Okay, preconception tests are preconception counseling and preconception tests should always be done whether you're planning your first pregnancy, second pregnancy. Uh, all those preconception tests tell us that whether you're having any kind of deficiency, like deficiency of folic acid, B12, can cause neural tube defect, Down syndrome. We should know that you are not carrying any sexually transmitted disease, or we should know your thalassemia status. Husband and wife should not be thalassemic, both of them, and any other genetic problem if there is. So, preconception counseling would tell us that whether you are carrying any kind of vaginal infection, anything which can compromise with our pregnancy. Every kind of test we do, and we make you healthy first by giving you folic acid for initial 3 months, and we test your vitamin D value. If you are absolutely healthy, your sugar levels are normal, your BP is normal, your uterus is absolutely healthy, and you're bleeding monthly, and there is no fibroid or any other uterine pathology, all after testing you completely in our preconception this thing tests and workup. We would give you a green signal that okay, now you are healthy and you can go ahead with pregnancy. Uh, Okay, so before something else come up, I'll continue with. So once, as I said, that gold standard to diagnose endometriosis would be laparoscopy. And if I would have said laparoscopy to that 18 years old girl, do you think she would have gone for it? I don't think, like 90% of you who are sitting there would definitely say no. Laparoscopic surgery for a girl who's just 18, it's really, really, we would think about it. But she had chocolate cysts, or both the ovaries were getting destroyed with big cysts, which were old blood, which was brown colored blood, which was filling every month. So there can be treatment for endometriosis. We should go, what is the best treatment? So as during questions also it came up, best treatment would be removing all the endometrial implants underneath that peritoneal layer, from bladder, from bowel, on your uterus, fallopian tubes or ovaries, and then giving you preventive medicine. It should not reoccur, because as I said that it can reoccur if you start your menstrual cycle again. Second therapy would be, if there is pain and we are not able to see any implants on ultrasound or MRI, and you are just having progressive pain, anti-inflammatory you can take absolutely safely. We can put you on progesterone only tablets, and it would give you complete pain relief. And but progression of disease would not be stopped. So we have to follow you up with regular ultrasounds, and if ultrasound shows something, MRI, to see whether disease is progressing or not. But yes, for because there was a mild to moderate disease, we could not see through our ultrasound modality any lesion there. We can put you on constant progesterone treatment or estrogen progesterone treatment continuously without giving any pause, so that you should not bleed, and there would be less chances of progression. There's another question which Bhuvan has asked. Ma'am, pregnancy test is showing negative, but she is delaying in menstruation. 2 weeks completely completed, still her menses stopped. Now, what should we do? So, Bhuvan, every time if somebody does not bleed or if periods are delayed, there can be many reasons. First reason would be that uh, she might be having hypothyroidism. There is another hormone which is called prolactin, because of stress, because she took lots of antacid drugs, and prolactin level has increased, and that might have caused delayed periods. Or somebody is having jet lag because of prolonged or regular traveling, or because of not able to get proper sleep, night duties. And sometimes, yes, if somebody has taken morning after pill or has not tested for pregnancy, or pregnancy, if somebody is having a delayed cycle, like if somebody is having the cyclicity of 35 days, 40 days, and pregnancy would be tested after some time, but right now it is not showing that it is positive. So there can be many reasons of delayed periods. Mostly it is hormonal. It can be thyroid, prolactin, PCOS, and so on and so forth. But lifestyle is very important. If you are having lethargic lifestyle, if you are not having proper sleep, if you are not exercising, if you have lots of screen time, all these things also can give um, all can cause delayed periods. Nandini again has asked, okay, thank you, doctor. This was quite helpful information. Thank you, Nandini. So there's still more to go. Stay here. Uh, so if I say that, okay, so once we remove all the disease, or we diagnose the disease laparoscopically, we would put you on either only progesterone or estrogen progesterone or LNG device in your uterus, and then it would be the disease would not progress further. So, question as somebody asked that whether the wife would be fertile ever, or whether they would be able to have baby. I should. This is a message for all the mothers. I would want to tell that. See, if we are able to diagnose endometriosis on time and suppress it on time, your girl who's 17 or 18 right now, and we have diagnosed and you have accepted the treatment, which would be totally only oral medication, as I said, that constant only progesterone tablet every day to suppress her bleeding, she would be fertile whenever she would want. Like if she gets married at around 28 years of age and starts planning at around 35 years of age. But if we would not treat her right now, she would be having this kind of, this is progressive, this incapacitating pain, progressive pain, disease would progress, and it will cause the whole anatomy would be disturbed. Her ovaries might go dysfunctional, and tubes also would get engulfed in that disease, which is not a right thing. So we have to understand, and mothers should understand that giving hormonal tablets to suppress endometriosis, or giving anti-inflammatory to suppress the pain, is absolutely safe, and it will preserve their fertility for future, and it is not harmful at all, and they would be able to conceive on their own. And we have beautiful medical facility where if not naturally, we have ovulation induction, IUI, IVF, and they are able to have their own child. So if we have any question, otherwise I have a list of questions. If you are still interested, I should read those questions and answer myself. Okay. So, will this help? Okay, so let's start. How to diagnose? We have already told you. And what is the right treatment of endometriosis? So, right treatment of endometriosis starts from anti-inflammatory first-line therapy, estrogen, progesterone, or combined estrogen, progesterone, which is also called oral contraceptive pills, or only progesterone pills. Next would be intrauterine device, which is called LNG device, or also popularly known as Mirena. Definitive treatment is laparoscopy, minimally invasive surgery, and it is an experienced hand. It is a very safe surgery. We should completely remove the disease and convince you and counsel you that you have to take regular treatment till you want to have your fertility. or till you want to conceive. Like if you are not planning right now, please continuously take that treatment till you're ready for your family. If one takes hormonal pill, will there be side effects? What can I expect? So I should say that, see, hormonal pill or any pill for that matter would be having some or the other side effect. So a hormonal pill might give you a little nausea initially, but then it would fade away. A little water retention, breast soreness, but everything would remain for some time. And once your body is adapted or adjusted to its effects, though all those side effects, it would not give you any long-term side effect. So, and you have to weigh the situation. You are dealing with endometriosis, which is a very, very progressive and frustrating disease. It would progress for uh, sure if you have to take an data. Almost 25 to 50% of infertile females are having endometriosis. So if you have to weigh the situation, OC pills are much, much safer than progression of disease. What is hormonal IUD and is it better option than pills? Uh, okay, so it is better because it is inserted inside the uterus, and it would not give you any systemic side effects. As I said, that nausea, water retention, a little weight gain, or sometimes if a girl is wearing contact lenses and having oral contraceptive pills, she might not be able to wear contact lenses because of waterlogging in her cornea, and she would be having gritty feeling. So all these things, all these systemic side effects would not be there if we insert Mirena in the uterus, because it is a locally effective progesterone. Will this help preserve fertility, and how? It would help help preserve fertility, because now bleeding would stop altogether, and these endometrial glands, this menstrual blood, this would not go back, and it would not progress further. If disease is not progressing, and the present disease, whatever is there, we have removed completely through laparoscopically, it is going to preserve your eggs, your anatomy, and your fertility. Okay, so Mamta has asked that can endometriosis be cured through medication only? Mamta, initially, if there are, if one thing is it's very, very mild disease, if you are not able to see a disease through ultrasound or MRI, all those implants, because those are very microscopic things, and if we put you on say combined oral contraceptive pill, estrogen progesterone pill, or only progesterone pill, and you respond beautifully, your symptoms are free, you're symptom free, you do not have pain, you do not have painful intercourse, your all those symptoms, like while you were having pain while passing urine or while pooping, all those symptoms are gone with these medicines. Yes, it is curable, but as I said, that we have to follow it up with ultrasound and clinically also, because I this disease would slowly progress. Mirena also, or all those tablets also, cannot completely suppress the disease. It would definitely delay its progress, and sometimes yes, it would stop also, but we are not sure in which case it would be completely helping curing the disease, or in which case. So we should be following it up. Okay, so what are the various possible complications with untreated endometriosis? Endometriosis in every case would be different. Somebody would be having endometriosis and she would not be having any symptom at all. And we would be able to diagnose only accidentally if we did ultrasound for her preventive health checkup. And she never had any symptom, but her ultrasound is showing that she is having endometriotic cysts, and the whole tubes are filled with blood, fallopian tubes are filled with blood. So it can, you would be having a very grave disease, but you would not be having any symptoms, or you would be having very mild microscopic implants. Ultrasound would show absolute clear picture, but your symptoms would be really, really severe during menses, or otherwise constant pelvic pain. So whether it can cause untreated endometriosis can cause complications or not, I think, okay, if you are having endometriosis, you know already that you are having endometriosis, and still you're not treating it, it is a progressive disease. It can progress, and give rise to, it can disturb the anatomy of fallopian tube and ovaries, or your bowel or your bladder. And yes, it can give you many complications, and most severe complication is constant pelvic pain, which is not uh, uh, which all other medicines like anti-inflammatory also at one point of time would not be able to relieve your pain. So, what is an endometriotic cyst or chocolate cyst? I guess we have answered that. Chocolate cyst is a blood which is coming from the uterus through fallopian tube in the ovary and getting collected there. And because it is old blood, and like every month it is getting collected, it is now brown color, tar, thick blood in the ovary, which is called chocolate cyst. Mm. When and why is it necessary to undergo surgery for endometriotic cysts or chocolate cysts? So, as soon as we diagnose that you have chocolate cysts, I don't think there should be any delay, because it is a progressive disease. It is not going to stop there. But if you are planning for conception and we see that we are able to see many eggs, even if there is this cyst there, but we are able to retrieve those eggs. And even if fallopian tubes are blocked, everything is not working for natural conception, but if you are able to retrieve the eggs, we would say, okay, you can have IVF and you should don't go for surgery. But if there is a disease diagnosed, then surgery is the most appropriate way. Can I have baby if I have chocolate cyst? Yes, if your ovary is not totally destroyed and we have many number of eggs still there in our ovaries, we can remove chocolate cysts. We can give some time to ovary to breathe again and start producing eggs. And yes, in many cases, they are able to have their own child, if not naturally. And again, I'm telling you, if not naturally, because sometimes fallopian tubes are also disturbed and their anatomy is distorted. But if we have eggs in our ovaries, we can conceive with many other means or many other treatment options. So, when and why is hysterectomy advised for endometriosis? So there is a part two. Endometriosis, as we were telling that it is retrograde menstruation going from fallopian tube on the ovaries. Part two is endometriotic tissue growing inside the uterus, in the uterine musculature. So that is called adenomyosis. So if uterus itself is growing bigger because the old blood is getting collected in the muscle, that is called adenomyosis. And this adenomyosis again, because from the muscle, this blood cannot come out in the cavity. It is there is only one way. Blood can go in the muscle but cannot come out. And that blood is getting collected in the muscle and there is no space, no exit, and it is really painful. Uterus starts growing and it starts pressing on your bladder or pressing on your bowel. And this adenomyosis, if it has started, first line therapy would be intrauterine device, which is LNG device, again properly popularly known as Mirena. That if we insert slowly and steadily, it starts shrinking, adenomyosis starts shrinking, and you would be having pain-free time zone, and eventually it might reduce your pain. But if it is not effective, if adenomyosis has become an adenomyoma, uh, then I don't think that, and I believe that Mirena or LNG device would not be helpful. In that case, we have to remove uterus to eradicate the disease. When is laparoscopic surgery recommended, and when does one have to go for open surgery? Uh, See, laparoscopy is the surgery, because if we go minimally invasive way, chances that we are injuring less other organs, we are able to have a panoramic view of every organ system. We are looking through camera and we can see your urinary bladder in front and uterus and sideways fallopian tube, ovaries, lateral pelvic wall, bowel, intestine, everything in one panoramic view, and we are able to map all the endometriotic implant and remove this. Abdominal surgery has no role mostly until unless somebody is having totally adhered structures and it's glued to each other and it's called frozen pelvis, and we are not able to go through those small holes, laparoscopic holes, which is very, very rare. But yes, if very rarely laparoscopic surgery might be converted into open surgery or laparotomy, which we say if we are absolutely not able to make out there is what structure exactly are we are dealing with. Okay, so I think I have covered the topic from my side, and I hope that it would be helpful for all the young girls. And it is a disease of reproductive age group, and as soon as your girl starts menstruating and she's having pain for first 2 days or first day of period or starts 2 or 3 days prior, I would request every mother, do not ignore, do not tell them that it is okay to have pain and they should bear it. You should go to gynecologist, consult gynecologist, because one, pain is not normal for any for girls to have. They have a productive life. They should be playing. They should be enjoying their life. They should be ahead in their studies. So they should have pain relief medicine. And if it is diagnosed that it is endometriosis, please, please, as your doctor advised, if she advises laparoscopy to remove the disease, do not be hesitant. First thing is get correct diagnosis by all the modalities, and if we are still not able to diagnose, gold standard to diagnose endometriosis is laparoscopy. And during laparoscopy, if we are able to see implants, we can remove it right there and then and there. And then prevention is the only long-term cure. Thank you. I hope it's helpful. And if you have any comment or if you want that we should be talking about any other topic of your interest, please write on the comment box and we'll get back to you. Thank you, everyone. Enjoy your Sunday.